I know there are several tests or a couple of tests that one
Correct.
can do to determine if they have an allergy. One is skin and the other one is blood. Can you talk about those two?
Correct. So we try to do what are called zone allergy testing. So zone meaning as in this zone or this area of the United States, and we're particularly in a zone 4 allergy, or so it's sort of divided into regions.
Is that a high number?
No. It's not a ranking or anything like that. It's like zone number 4. Like we are in zone 4. Like upper Midwest would be like zone 2 or whatever it may be. So the reason why that's important is because obviously you want to test what you're most exposed to. So if we do blood tests on you, we want to make sure that we're testing you for the things that are common in our environment. So the trees and the molds and the dust mites and our environment would be different than, let's say, the southwestern United States or the Midwest or the Northeast or whatever it may be. So those types of tests are very important to be able to make sure that you're being tested for the right environment. So that's number one. Number two is blood tests. Blood tests are typically easier to do than to do the skin test because
there's a lot
it's a singular blood test, just like any other blood test, like a CBC or any other blood test. So a lot of times it can be included with like your annual labs if this is addressed at the time of your annual well visit. And that can begin to open the door for education. And you know that I always like to educate my patients. So, you know, educating patients is always very important. How do I try to make sure that I avoid these things? Hey, Mr. So-and-so, here are your allergens. These are the things that are triggering your allergies. The tough one is the animals trying to convince people, hey, listen, I'm sorry, but you're allergic to your cat. So you need to get rid of your cat. So that's always a tough conversation to have. But it's education that matters, because then at least the patient can begin to put in avoidance techniques. And those avoidance techniques are very important because a lot of times there's plenty of over-the-counter medications that are available to you as a patient, but we need to make sure that you're using those medications correctly.